This is Dr. Toby Moma. It's a pleasure to welcome you to our show this week. You don't want to miss Chaplain Tanya Jefferson. Tanya Jefferson trained as an accountant, and after her career as an accountant, went back to seminary and got a master's in divinity, and afterwards spent a 2-year period in residency in the Veteran Affairs Hospital. Chaplain Jefferson is a trained, certified chaplain who works at the Jackson Veteran Affairs Hospital. She's going to share with you her burden for the veterans and how she ministers to them in the midst of PTSD, in the midst of distress, in the midst of trauma, in the midst of chronic medical illnesses. She's going to be sharing a part of her life about how she was raised in the Delta in Belzoni and how God has brought her thus far. You don't want to miss this interview. She's a female, she's a chaplain, and she's ministering to our veterans from a Christian perspective. You will be blessed. Jesus is Lord. Amen. Hi, this is your host, Toby Moma, on Health and Wellness with Dr. Toby. What an honor, what a privilege to have you on our show. Thank God it's another day on the show with Miss Chaplain Tanya Jefferson. We're privileged to have her on the show. Tanya is a chaplain at the Veteran Affairs Hospital in Jackson, Mississippi. She started out as an accountant working in Jackson after being trained at Tougaloo College in Jackson, Mississippi. Went to Atlanta, obtained a master's in divinity, and went from there, did an internship at the VA, and then 2 residencies. And now she's working as a chaplain, taking care of our veterans at the Veterans Affairs Hospital in Jackson, Mississippi. And the white coat she's wearing, according to her, is what the chaplains in the hospital wear. So I wanted to find out from you, because most of my viewers have no idea what a chaplain in a military hospital do. You know, we see chaplains mostly in the war front praying over soldiers before they go to war, or praying over soldiers after they've been killed and you want to commit them to Mother Earth. We've never heard a whole lot about hospital chaplains in the VA or the military settings. Can you give us what do they do? What are your terms of reference at the Veterans Affairs in Jackson?
As a hospital chaplain, we serve in a healthcare setting, which is the VA Medical Center, and we're specialized. We are fully recognized as part of the interdisciplinary team, which consists of physicians, psychologists, social workers, because we're trying to provide whole health for the whole of the veteran in mind, body, and spirit. So we're trying to we attempt to address all those needs. And for instance, I am a clinical certified chaplain. So we represent ourselves as a subject matter expert in the area of chaplaincy. And because it's so important, most people when they see the chaplain, they think the chaplain only prays. But
that's what most people think.
Yeah, that's what most people think.
Oh, you're there to commit somebody to when they're about to die.
Yes, but the chaplain, not similar to a physician like yourself, how you diagnose the physical, a chaplain can diagnose the spiritual and emotional needs of the veteran or the patient or wherever that chaplain might be serving. And to be a chaplain in the VA system, it requires that you have a Master's of Divinity, 4 units of clinical pastoral education. You mentioned my residencies early. It also requires that you have ecclesiastical endorsement, and lately you have to be board certified
in
chaplaincy, a board certified chaplain.
Wow.
And so that can take a long time. Like for me, with my Master's of Divinity in the clinical pastoral education, that was like 6.5 years of training. And so that training, it prepares you not just to pray. You know, most of us already know how to pray. So the chaplaincy role, I see the chaplaincy role as fourfold. And when I say that, you're a spiritual care provider where you make spiritual assessments and you provide, I say I care because those are the values of the VA: integrity, commitment, advocacy, respect, and it's one more. And so we provide I care, spiritual care to the veterans. And your address, that's the spiritual care provider of it. And then you also serve as an advocate or a mediator in the sense that there may be issues of moral injury or ethical issues or in the life issues, like whether or not the patient had an advance directive, and you may encounter family members who, where one, if they didn't have an advance directive, or where the family members are, one family member may want to leave the person on life support, and another family member may say, okay, daddy didn't want that. So as the chaplain, you have to support both of those family members and offer a ministry of presence and listen, make sure you're actively in listening to the family members where you can serve as a mediator. So that's the second. And then a chaplain also serve as a facilitator. When veterans go off to war, some return with PTSD or moral injury. And so there are groups that you serve, you prepare a curriculum for PTSD, they're really spirituality groups centered around PTSD, substance abuse, so all these, so you're a facilitator. And usually in those groups, I say facilitator because you're guiding the group. You're not just going in, you're going in actually listening to them. You may have a title of self-identity. Who am I? And then who was I before PTSD? And so you're really trying to get the veteran to reframe and reshape and come back to who they were, not minimizing. You never minimize their current reality, but nurturing them and getting them to accept and embrace new attitudes that were already there in them. So that's the facilitator. And then I say spiritual leader. As a spiritual leader, you conduct worship services, you can perform baptisms. So I say spiritual leader. And I think I covered all of the different roles.
Do you think you're a minority in terms of African American female chaplain in the Veteran Affairs? Are you a minority in the sense that most patients are male, and I'm sure most of the chaplains are maybe male too? So do you ever feel intimidated? Do you ever feel ostracized? Do you ever feel disenfranchised? Is it intimidating to be a female in the VA chaplaincy system?
No, the veterans, most of them are open.
Of course.
Most of them are open because they have encountered military chaplains. So the veterans respect what I'm bringing to the table. And with that, we always have to ask permission. The first thing, you have to ask permission. Ask the veteran, is it okay or is it a good time for a visit? And they have to give us permission to actually be in the room. So my encounter doing my 2.5 years of residency and intern, and now returning as a clinical staff chaplain, the veterans have been open. And sometimes some veterans, depend on what they have the issue they may have, they may request for a female chaplain because they may not feel comfortable talking to. It just depends on what their level of need is. But I am within the department right now. I am the only female chaplain, but the beauty of it, I am serving with chaplains who have all been in the military.
Oh wow!
So we all have a love for the veterans, and they actually have served in the military. I have not served in the military, but we work together as a team.
So they can educate you on some
yes,
of the
yes.
nuances of the
Right,
military.
right,
like
right.
post-traumatic stress, which you've read
Right,
about, obviously.
right, right.
Interesting.
So it's like we work together as a team. I follow them, they follow me. So it's.
So this is a bit of a sensitive question, but
Yes.
do you think your father's early death moved you or precipitated or inspired this care that you give to old, maybe use the word infirmed, maybe I'll use the word dying, elderly males? Do you think?
And not all of them are dying. And
Okay.
I try to use the word wiser or wisdom instead of older.
Okay.
But at the same time, I think my love for veterans stemmed from uncles.
Oh.
My father wasn't a veteran, but I had uncles that
My question
were
was, did you
veterans.
care for your dad? Did it make you, did you see him in his last stages of cancer?
I did. We would visit the hospital.
Okay.
My mother did. Like my mother has been a caregiver to her father,
Okay.
my grandfather, and then to my
Your dad.
grandmother.
Oh,
My father passed before my grandmother.
oh wow.
And so she was right there with each of them
Oh wow.
when they passed away. And so that caregiving spirit has been passed
Passed on
down
to you. Right.
to me and my brother. And she sometimes says she want to go to nursing home, but we're like, we saw you take care of each one of your loved ones.
Wow.
Let us take care of you. You've taken care of us. Let us take. But back to your question, I want to stay on task about veterans. I think my love for veterans come from growing up with uncles who migrated to Michigan during the Great Migration from Mississippi for better jobs. But one of them had served in the Vietnam War, another one in Korea, and an aunt enlisted, and
Wow.
another uncle who had been enlisted. And so now, back then, there was no diagnosis, because when the Vietnam War was, there was no diagnosis of PTSD. So what you would see PTSD carried out as through alcohol. And so I always wondered, they would never talk about their experiences. It would be so hard, especially the one that was in Vietnam.
Oh wow.
All he said was he was a driver. But I know he got shot in Vietnam. But he would never
Recollect.
never talk about the experience, never would go to the VA to get the help that I thought he needed. And the illness coping style was alcohol.
Oh wow.
And so now, fast forwarding, it's a lot of help with that. We always had AA.
Yeah.
But it's hard to get people to come to AA. So I think the Veterans Administration creates a safe space where other veterans can share who know what this veteran is going through.
Right.
And they can have a safe space in these different groups, like the PTSD group, the alcohol, drug, and trauma program, where they can have a safe space where they can come and talk about their different issues and have someone who can relate to them.
Wow.
So I think the Veterans Hospital has done a great job with creating that safe space for veterans to have those small group settings.
Okay. Tell me a bit, give me a specific day in the life of a chaplain at the VA hospital. Give me a specific day. When does your day start? When does your day end? Because there are young girls watching who may want to go into being a chaplain, and they're looking at Chaplain Tanya and saying, I want to be like Chaplain Tanya.
So a typical day, we start off with a morning huddle. We discuss if we have any
With
concerns
who?
with the team, with the chaplain team.
Okay.
So we start out with the chaplain team. We start off with a morning huddle to make sure, just checking in with each other, just making sure you're checking in with each other. Any announcements and prayer before we start our day, before we go see the veterans. So that's how we start off. And then a typical day, you print a patient list and you look at the patient list, whatever floor. I'm on mental health.
Okay.
So you make sure you see the patients on mental health within the first 48 hours of the patient being admitted to the hospital. So it varies on the number of patients that you see. And so I serve mental health, but there's also a chaplain that serves in palliative care.
Okay.
There's also a chaplain that serves in the community living center, and there's a home-based chaplain as well. So a typical day just depends on what area you're serving. And mental health, I can leave and go up on, because I'm passionate about what I do. I can leave because you're trying to get there before lunch.
Right.
But you don't want to go too early because they may not be up. And so 10 o'clock is usually when I like
Your first appointment.
Yeah,
Okay.
usually when I like to start. And during those visits, it's more about getting permission, one, to get in the room, and then listening. It's so critical to listen.
You call it the
Active listening or
presence.
yes, the offering the ministry of presence.
The ministry of presence.
Yes,
right.
offering the ministry of presence, but in that ministry of presence, making sure that you're actually hearing the patient. So for me, I go in with an open heart and open ears and I also notice their ABC, their affect or their behavior, to see what their eyes are telling, because most patients want to know that you see them and you hear them.
Right.
So that's critical. In listening to them, to be able to follow the patient, not getting ahead of the patient and taking them where I think they should go, but listening and using what they're telling you, whether it's their theology or their experience, but using that to help them reshape and reframe, but not going in saying, this is what you need to do this, because
Right.
you don't never want to minimize a patient's reality. And so in a nutshell, I believe personally, I'm called to serve marginalized and vulnerable populations. So I would say to a young lady, to tap into a young lady or young gentleman, tap into what you're passionate about.
Two things I want you to talk to me about. If you have a patient in the clinic who's having post-traumatic stress disorder, a male who was in the Vietnam War but is having post-traumatic stress disorder, or a female who was violently raped by her male colleagues, how can you counsel those people? How can you talk to those people to avoid them getting, how would you minister to those people with the spirit of presence?
With one, again, listening, and usually with military sexual trauma, sometimes it hasn't, some people have not reported it, but it's something about talking to the chaplain. They're, once if that's expressed in a visit, there are military sexual trauma coordinators. That's the first step. You want to get them to that military sexual trauma coordinator. So that's where you serve as an advocate, referring them to the military sexual trauma coordinator,
Okay.
but also provide listening to them and exploring their theology. Um, where do they see God in this illness experience, and listening to them and using that to provide spiritual care. Like I said, sometimes a veteran may not want you to pray for them. They just might want you to listen and know that you are actively listening, seeing them. But hearing that and getting them the tools and resources they need to get the additional help that they may have not sought when they were in the military.
So the PTSD, you obviously work with the psychologist,
Yes,
psychiatry,
yes.
and all that. Have you been seeing a lot of that because the data shows maybe a 5 to 10% from those who come back from, the war zones. So I don't know, is it a common thing? Because there was a lot of stories about suicide in the military. After this Iraq war, there was a lot of stories about veterans killing themselves, and I think the VA set up a hotline just for veterans who were trying to
Have the
commit
crisis
suicide.
hotline, yes,
Yeah.
yes.
So how does your role help shape that? How do you reduce those numbers? How does the VA expect the chaplaincy to help them in those distress situations?
Well, one, with the PTSD, like I alluded earlier, they have a spirituality group, because with the Veterans Healthcare Administration, you're providing for the whole of the veteran. So it's mind, body, and spirit. And so you're having um, groups, small groups, support group sessions, and it's with other veterans.
Okay.
And so for me, it's more interactive, like offering that presence as a facilitator to guide the group participants where you're hearing them. And it, like I said earlier, it creates a space for them to share, to get it out, that it's a safe space and they're comfortable. Usually they're comfortable sharing it with the chaplain and with others who are around them. So just actually having that space and time where they can come in a small group setting
Right.
and be able to.
So loneliness can breed that suicide spirit when you're not interacting with other people.
Right, right. So
So
making sure that they're not isolated or
isolated.
alienated, and creating that space where others who have experienced what they have experienced, they can.
There's been a lot of stories about rape in the military, but let me talk about a little bit about, as a female working in a predominantly male environment, how do you avoid getting emotionally, let me use the word, involved with your patient? Because as a chaplain, they're gonna be sharing their stories, their heart, their vulnerabilities, and some might open up to you in other areas that they don't open up to even doctors and nurses. So you may find yourself knowing more about that person than his or her regular physician. So how do you avoid getting emotionally caught up and
And now
intertwined with that person?
I'm glad that you touched on that. With the clinical pastoral education training, one of the things with being a chaplain, one of the outcomes is being able to be emotional vulnerable, to be able to walk alongside that person that's broken, and walking alongside them until they can possibly find a place of wholeness. But also making sure that I'm not, sometimes you can over identify with the patient, because there's a difference, I think, in empathy and sympathy. So you want to empathize with the patient, But if you sympathize, you start taking it on as your own.
As your
So
own.
making sure having self-awareness, which the clinical pastoral education, it teaches us to have awareness, and you go through so many, I went through so many years to make sure you can deal with those triggers, because something in this patient might trigger you,
Right.
but at the same time, knowing how to handle those triggers, and so you can be emotional available to the patient, because if you don't know how to deal with those triggers, you can over identify with the patient, and when you over identify, I don't think you're helping.
Right.
You're not helping the patient if you're over
So
identifying.
just setting boundaries.
Setting boundaries
You
and
don't
having
wanna
that
cross
balance.
those boundaries
Yeah.
and
Yeah.
obviously not, going on a date with them, or
Oh, no,
I mean,
definitely
you know what I
not.
mean? Not becoming emotionally involved with
Right.
the patient.
Definitely
Those
not.
are unethical things that
Yes.
chaplains should not be involved in.
Because as a female, I'm often making sure I'm maintaining professional boundaries and not crossing boundaries.
Right.
And I give you a good example. If I'm working on mental health, I might not wear a dress. I wear pants. I make sure I'm wearing pants to make sure I'm not sending a message, or making sure, that's one of the ways I maintain boundaries, making sure my attire
Doesn't give the wrong
give
impression.
doesn't give the
Okay.
wrong impression. And also, when I go in a room, I make sure that I'm closer to the door.
Oh. Okay. Any influences on your life in the chaplaincy? Any inspires? Somebody who inspired you, who helped mentor you?
Yes. Her name is Chaplain. I know Chaplain Vivian Oliver,
A female.
a female who
Okay.
started her chaplaincy journey as a second career at the age of 64.
Oh wow. Here in Jackson?
No, she's from Tuscaloosa. She did her training because the Jackson VA was had a satellite unit with Tuscaloosa.
Oh.
And so, but they don't have it now. But she actually did her training at GV Sonny Montgomery VA and Tuscaloosa VA, which was a satellite of GV Sonny Montgomery VA. And what's so inspiring about her, she relocated to do her residency in South Dakota, and she's 60 plus years old.
Wow.
And she received her first chaplaincy job at the age of 65. And today is actually her birthday. She's
Okay.
67 years old.
Wow.
And
she's working in South Dakota.
she's not South Dakota. She's now at the Tampa VA.
Wow.
So she's really an inspiration because she's not military.
Really?
She didn't have a veteran's preference.
Oh wow.
So she inspired me because I'm not a veteran. And so
We're going to come back. Tanya is going to share more about her heart for the military and how you can be a blessing to the military. I know our TV viewers love the military. We're going to share with you other ways you can contribute when you talk about the military and supporting them. Don't forget, see you next week. God bless you. Jesus is Lord. Amen.
That's it.